Helen Jones, move the motion, please.
Good afternoon, Sir Roger. It's a great pleasure to be here under your chairmanship this afternoon. And I beg to move that the House has considered e-petition number 225767, calling for the age at which women are offered cervical screening to be reduced from 25 to 18. Before I move to the substance of this debate, I want to say a little about the woman who started this petition, Natasha Sale. She died on the 28th of December last year. And she was 31 and left 4 children. I've spoken to her friends this afternoon, and I think Natasha must have been a remarkable person, because it takes a remarkable person to decide when they have a terminal diagnosis that they will use their time to help others rather than to bemoan their own fate. That is what Natasha did. She said in her petition, it's too late for me, but it's not too late for the next generation. I want also to thank her family and friends who encourage people to sign this petition in order to get a debate here today, particularly Natasha's family, who have kindly said that they are happy with this debate going ahead. And that too takes courage, and I am grateful to them. I think that cervical cancer is something that all women fear. Like breast cancer, it's something that strikes at the heart of how we see ourselves, how we define ourselves as women. And it is because of that that screening programmes have been introduced in this country. In fact, the screening is changing so that women will be tested for the HPV virus first before they actually get cervical screening, because most cancers, not all, but most cervical cancers are caused by the HPV virus. Currently, screening is only on offer for women between the ages of 25 and 64. Those between 25 and 49 are called every 3 years, those from 50 upwards every 5 years. And yet, the reasoning behind this is perhaps not often understood. It is that before the age of 25, not only is such cancer very rare, but changes in the cervix are very common. And so a test can produce false positives and lead to unnecessary treatment and anxiety for women. Nevertheless, there have been repeated calls to lower the age of screening, not just in this petition, but in others, and in one that we received previously. However, in response, the government would say, rightly, that the UK National Screening Committee has looked at the evidence and decided that there is no real evidence to support reducing the age of screening. Their reasoning, and I think it's a valid reason, is that 1 in 3 tests below that age will produce a false positive, but also that then when people are given unnecessary treatment, there is a risk to future pregnancies. Now, what I hope the government will do is publish the evidence both on the risks of getting cervical cancer at that age and the risks from screening, so that women are able to make an informed decision. And to publish that in a way that can be understood by people like myself who are not doctors and not scientists. Very often we see the evidence couched in scientific jargon, and that conveys very little to most of us. So that is the first important thing that we want to do. Nevertheless, there will always be some cases, and when we have cases in young women, they can be very tragic. They can lead to the loss of a young life, and often children left without their mother. It was because this disease can be so devastating that in 2008, the then Labour government introduced a programme of vaccination against the most virulent forms of the HPV virus for all girls from the age of 12. In fact, in those first cohort, we vaccinated up to the age of 18 in order for there to be a catch-up. Now, those who were 18 at the time will now be undergoing their first screening. If, as expected, the rate of cervical cancer in that age group drops, then it will have been well worthwhile. But I well remember when it was introduced that MPs were getting a lot of letters from parents who said they did not want their daughters vaccinated. That still happens, because they somehow saw this as encouraging promiscuity. That is not what it is about. What it was about is vaccinating girls before they became sexually active. And I do hope that parents will think about the risk they are putting their daughters through if they do not have these vaccinations. I give way to the honourable gentleman.
Thank you, Honourable Lady, for giving way, and thank you for presenting the case for this today. Does the Honourable Lady not agree that whilst the vaccine has been shown to lower incidence of cervical cancer, the fact is that cervical screening should take place as a matter of urgency, of course, but most initially for those who are sexually active, with the active age being 15.6 years across the United Kingdom of Great Britain and Northern Ireland? Does the Honourable Lady not agree that to wait 10 years for a first cervical smear just can't be allowed to happen, and it must be addressed immediately?
To that in a moment, because I think it is important that we look at the evidence. There will always be some cases, even amongst women under 25. You never eliminate the risk completely. And when that happens, it is important that they get the right treatment, which is why in 2010, guidelines were published for GPs to ensure that young women who presented with abnormal symptoms were offered screening and were referred on to a consultant if necessary. That does not always happen, and I'll come to that in a moment, but I give way to my honourable friend.
Very grateful to my honourable friend for giving way, and I apologise that I'm not able to stay for the whole debate. But I wonder what monitoring is done of GPs providing that screening. And indeed, for women over the age of 25, I myself had a smear that presented as abnormal. I had HPV. I went to my local doctors and asked for my smear test that I was required to have, and was told by my GP they didn't do smear tests. So what monitoring is being done to make sure that all GPs are adhering to the guidance and their duties under the legislation?
My honourable friend makes a very good point. It's something I will be asking the Minister to look at. But our first problem is often getting people through the door, because it is natural to think if there's something wrong with us, it will somehow go away. Or to think, oh, it might be cancer, and kid ourselves that if we don't get a diagnosis, it's somehow not happening. What we need to do is have much more publicity to encourage young women to report to their GP if they have abnormal symptoms. After all, it might not be cancer, and you might be reassured, but equally, if it is, the sooner you get treated, the better your chances of survival. And I don't think that message is always getting through, particularly to younger women. The other problem, of course, is that the rates of people attending for screening, even amongst those eligible, are falling. In the last year, for which I have the figures, only 69.1% of eligible women attended for their screening appointments. That is down from 73.7 in 2011. What that means in practice is that there are 3.5 million women in this country who have not been screened in the past 3.5 years, and that is very worrying. Even more worrying is the fact that 1.7 million have never had a test, and 345,000 have not had a test in the last 10 years. What is more, there are significant regional variations between the rates of screening. So, for instance, if you look at those aged between 25 and 49, the rate of screening in London is 61.1%. 61.6, sorry. In the North East, it's 72.9%. If you look at the over 50s, the rate in London is 74%. Go to the East Midlands, and it's 78%. Wow. Now, we really need to look very closely at these figures and find out why women are not attending. It is no use getting into the blame culture. We need to ask the right questions. Are they frightened, for example? Are appointments not at convenient times? Are there particular groups of women who are not turning up for screening? In fact, it's probably a mixture of all three. I was sent some very interesting information from Joe's Trust, who asked a group of young women in a survey why they didn't attend for their screening. 71% of those women said they were frightened of the test, and 75% said they felt vulnerable. A whopping 81% said they were embarrassed. Wow. And I think this is a particular factor for young women who are constantly being bombarded by airbrushed photos of what they should look like, what their body should be like, and so on. And so they suffer from a lot of, body consciousness, really. And despite the fact that doctors and nurses keep repeating that we don't care what you look like, we're not interested in what you're wearing, we do hundreds of these tests, that message is not getting through. So it's important, I think, that tests are conducted in a very supportive environment. Because interestingly, in the same survey, 67% of the women surveyed said they felt they weren't in control of the test. But 68% said they wouldn't discuss their fears with a doctor or a nurse. Now, that particular problem applies to survivors of sexual assault too. 72% of them put off going for their screening or don't go at all. So it's vital that women are screened in a supportive environment where they get the chance to discuss any fears they have with a practitioner beforehand. Yes, I give way to my honourable friend.
I thank my honourable friend for giving way. She's making an excellent speech, and I apologise for not being able to be here for the whole of this absolutely critical debate. Cervical screening uptake in Wales is at an all-time low. I know that only a quarter of women, more than a quarter of women, didn't attend in the last year their cervical screening. And importantly, though, Wales last September became the first nation in the UK to provide high-risk HPV testing as the primary cervical screening test across Wales. So this leads to more sensitive and specific tests, more certainty to patients, and more appropriate referrals to colposcopy services, faster treatment, and then faster discharge times. Would my honourable friend agree?
Yes, I do agree, and I hope we will see those tests rolled out across the rest of Britain. But there is a real problem, actually, of women getting access to screening services. Time and time again, women report that they ring up their GP for an appointment, and it's weeks ahead. In fact, someone I've just met told me it was months ahead in her case. It can be as much as 10 weeks. Or they're offered appointments at times they can't attend, perhaps because they're working shifts. And that applies particularly to younger women who are more likely to be in insecure employment and therefore to not be eager to ask for time off. Now, I don't know why we persist in this. Very often, the comments on screening give the impression that someone is saying, oh, these stupid women are not going for their screening. Actually, there is a real problem of access. Now, I can remember when we had mobile breast cancer screening units that would come to a place of work. I got my blood pressure tested in the middle of Warrington Shopping Centre because the hospital were doing a programme to encourage people to go for testing in case they were at risk of vascular disease. So I had to ask myself, why can't we do more to take cervical screening to places where women are? Why can't they be screened in the workplace, for example, where I think groups of women are much more likely to say, come on, we'll all go together and get them down there. It's not beyond the wit of man to arrange that. I'll give way one more time, then I must make a bit of progress.
Thank you, Honourable Giveaway. The constituents have come to me, have expressed concerns on two issues. Number one, it's very painful. Number two is the embarrassment of the issue. And I have to say that when it comes to assuring and putting peace of mind to ladies who have to go for cervical cancer, whatever that age may be, it is very important that the doctors and the GPs perhaps are involved at an early stage to put their minds at rest. The importance of the cervical cancer screening can't be underlined enough, but the ladies need to be assured of not having the pain and not having the embarrassment. And I think it's a big task for the NHS to do.
Yeah. I think the Honourable Gentleman is right. Women need to be assured that they'll be treated sympathetically, whatever their age. And I think all of us have been for screening now. Sometimes it's fine. Sometimes you get someone who's a bit ham-fisted, and it's not fine. It is better than getting cancer, however. Now, the other issue that I think needs tackling is that when women under 25 present with abnormal symptoms, like abnormal vaginal bleeding, they are not always being treated according to the guidelines. In fact, they are frequently not being treated according to the guidelines. There are plenty of examples of younger women going to their GP with symptoms and being told they are too young, in inverted commas, for cervical screening. There are plenty of examples of women going time and time again and being, as one lady told me earlier, just fobbed off. Yeah. And the problem, of course, with this is that GPs don't see a lot of cases, and therefore it's not the first thing they think of. So the government, I think, must do more to alert GPs to the possibility to get early diagnosis and to make sure that people are referred to consultants where necessary. I give way.
The honourable member for giving way. I absolutely agree with what she said about GPs and others. They must take the concerns of younger people under 25 seriously. But I recently attended a pensioners' parliament in Northern Ireland, and many, many women over 64 also said of their difficulty about being taken seriously when they go to the doctor. The vast majority of deaths through cervical cancer happen to those over 50. Many of those are over 64. Is this not also an issue that needs to be addressed? Those women feel they're being left behind.
Helen Jones.
I think the honourable lady makes a good point. And what we need people to realise is that women know their own bodies. They know if something is wrong. So listen to what they say. There are too many examples of women having to pay for a private test before they found out they had cervical cancer. And of course, if the cancer is not diagnosed early, the chances are that it will become terminal. If it's diagnosed early, your chances of survival are much, much greater. So we need to ensure that people are diagnosed early. Now, of course, this leaves open the question of whether the age for screening should be reduced. I have to say, I am not convinced at the moment because the scientific evidence does not support that. But I hope the government will keep it under review because if the evidence changes, we need to change what we are doing. I know that Sir Mike Richards is doing a review of cancer screening and he's due to report by Easter, I think. I hope he will look at this issue because ministers must ensure they get the best advice and have to proceed on that advice. Because we have to remember that, rare though it is, in 2016, 15% of women diagnosed with cervical cancer were under 30. And last year, 12 of those who died were under 30. We can and we should be doing much more to prevent those deaths by ensuring that women get screened where necessary, even if they're under 25. They have indications that require them to be screened. They should be. By ensuring that we promote the Hpv vaccination programme, which is one of the best things that I think has been done in recent years. And I say to parents who are worried about this, please don't put your daughters at risk like that. Get them vaccinated. We have to do much more to convince them that that is the right thing. We have to do much more to make screening accessible and easily available to women, and to make sure that it's done in a supportive environment. It is often, let's be honest, a bit like a sausage machine when you go to your GP, precisely because health workers are doing this all the time. To them, it isn't at all unusual, but it is to the people going, and that's the difference. Once more, yeah.
I thank you very much for giving way. I hope that, like me, she's going to support the Public Health England awareness campaign that is about to start on this, which is going to try to tackle all the misunderstandings that there are about screening and to overcome those feelings of fear and embarrassment that she has so well described.
I think the honourable gentleman is quite right, and it's not before time that we had an awareness campaign on this. But it's no good having an awareness campaign unless you also ensure that screening is easily available and that people are treated well when they go for their screening. That is vital because one bad experience can put a woman off from going again, ever, and that's not where any of us, I think, want to be. Natasha started this petition because she wanted to raise awareness of the symptoms of cervical cancer. She wanted to ensure that other women did not suffer as she had suffered. I think that was a remarkable thing to do, and I hope that in today's debate, which I know her own MP, the Honourable Member for Newton Abbot, would like to be at, but has unfortunately had to be in the committee elsewhere, I hope today's debate will go some way to doing that, to open up the dialogue on how best to get women screened and when they should be screened. And I hope the Minister will commit in future to keeping the age of screening under review, that if the scientific evidence supports screening earlier, it is actually acted upon.
The question is that this House has considered the e-petition relating to lowering the age for smear tests for cervical cancer from 25 to 18. It's John Howell.
Thank you, Sir Roger, and it's a pleasure to serve under your chairmanship, and it's also a pleasure to follow the Honourable Lady in this important debate. I would like to start by thanking the petitioners for bringing this petition. It's good to have the opportunity of discussing an issue such as this in open debate, and I think that all members here will get a very strong impression that there is agreement around the House for what is being proposed. I think that I want to start with where I intervened on the Honourable Lady, and that's in my understanding of the Public Health England campaign. I agree with her that it's about time we had a campaign, and I agree that that it is going to have a hard job to tackle. On the one hand, it has the women themselves to tackle with this. It has to overcome the enormous misunderstandings that there are about the screening process, and it has to overcome the fear and embarrassment that surrounds this. I mean, it's not just this illness that there is fear about. I think anything to do with cancer creates fear. So there is an enormous amount to overcome on that. But I would suggest that the Public Health England campaign also looks at the other side. I think the Minister has heard us talk very strongly today about the impact on GPs and about the way in which GPs have to handle this issue and the way in which they have to make facilities available. So something in the campaign that targets them to make those points, to make sure that the testing goes in the right place at the right time and in the most effective manner would be a very good thing to do. The Honourable Lady has also mentioned the inoculation against the HPV virus, and I would support that. And I'm very, very pleased that we are now inoculating young boys against that as well. I think that makes a very big difference. If you have talked to some of the medical professionals in this area, you would have heard the stories about the number of people who develop cancer as a result of HPV, and it is very good to have that there to be able to support this campaign. Like her, I am not yet convinced that the age for this should be reduced. If we look around the world, it would seem that there has been a general trend to increase the start of the programs. I think the American Cancer Society recommended cervical screening goes up from 18 to 21. And I think that's a very interesting thing to bear in mind. And the reason that she and I believe that is, of course, the false positives that are created, And I don't think that anyone wants to be put in the situation of having a false positive test. This is not about the waste of money that is. It's about the individual concern that a false positive creates for them. So I am not yet convinced that the age should be brought down. But like her, I call on the Minister to look very carefully at this, to keep it always in his mind, and to keep reviewing this. I think that Scotland has actually increased from 20 to 25 the age at which women go for their first smear test, which I think too is an interesting reflection of the way that the situation is going. So I think that too builds into the difficulties that we have in dealing with this. But I do thank the Honourable Lady for presenting this case, and I do thank the petitioners for bringing it and for allowing us to discuss this in the way that we are.
Sarah Champion.
Thank you, once again to serve under your chairmanship. I'm actually very grateful that we're able to have this debate, and hugely grateful for the friends and family of Natasha and all those that signed the petition for enabling us to have this debate, because it's much needed. HPV accounts for 99.7% of cervical cancers. It also accounts for cancers in boys as well. The first point that I want to make is I would like the Minister to seriously consider rolling out the vaccine programme to boys as well. I can't think of any other inoculation programme where you only inoculate half of the population. It seems a very bizarre approach to try and eliminate a reasonably common form of cancer. I would also like to build on what my honourable friend from Warrington North said about the fears. As soon as I started tweeting about this, I had people coming back saying how dangerous the vaccine was. I'm sorry, but the evidence doesn't actually support that. This is an insurance policy for your children, and I need to urge parents to really look at the actual evidence rather than the scaremongering that we see on Facebook and Twitter around it. HPV is a sexually transmitted virus. As my friend from Strangford said, unfortunately, we are seeing children, on average, having sex at 15.6 years of age. Legally, they can have sex from the age of 16. So knowingly, to have a gap of 9 years when children are likely to be sexually active and are likely to be exposed to a sexually transmitted disease, but not have any screening, I'm sorry, but that doesn't make sense to me. When I started talking about this a couple of weeks ago, two of my friends came to me and said that that their cervical cancer was picked up at 21. They were incredibly fortunate in one way because they had a history of cancer in their family. They were on the programme for high-risk people, so it was picked up. I'm very concerned about the people that don't get picked up, that are not actively on that programme. Because if two of my friends had this at 21, I'm quite sure that there are many, many others who are at risk, who are not getting picked up until it's too late. I'd like to turn to the smear tests. And yes, they're not fun. They can be embarrassing. But with my own personal GP, they have now changed. So they're using a small brush, which is not anywhere near as uncomfortable. So again, I would say to the Minister, there are ways to minimise the discomfort of something like this. But I want to now bring myself to my personal experience. I've always gone for my smear tests. And I went for my smear test, as I always do, and actually got the letter back that we all dread to say that there were some abnormalities and would I go back for a biopsy. I went back for a biopsy, and lo and behold, it was confirmed that I had got cancerous cells. I didn't have any symptoms. If I had the symptoms, I would have probably put them down to something else, because the symptoms are irregular bleeding, discomfort during sex, back pain. I'm 49. I suffer those quite a lot anyway. At a younger age, and I'm sure, I look to the women in the room, those are not abnormal symptoms for us to have at any point, at any age. And certainly, if I had those symptoms, the last thing in my mind would have been thinking, oh my goodness, I might be at risk of cervical cancer, I must go and do something about it.
I was lucky. It was picked up really early. So I just had simple day surgery. I didn't require any further treatment. And 6 months, 2 weeks ago, I got the letter saying that I was all clear, which is just wonderful. And I want everyone to know about that, which is why I'm so grateful that this petition was put forward. It's why I'm so grateful that there are campaigns, and why I'm so concerned that the number of women going for smear tests is dropping. And that figure from my honourable friend from Warrington North, that 1.7 million women have never had a smear test, it chills me. But what I also want to say to the Minister is there is often very good reasons why women aren't going forwards. And of the women that I speak to, a lot of that is due to past sexual violence, childhood trauma. So what I would say to the Minister is, in the guidance that goes out to GPs, if a woman either has never been or has been missing a number of appointments, is it possible in the chase-up letter not to assume it's a woman being difficult or she can't be bothered, but actually to put something in there to say, you know, we understand this can be very difficult, here is the nurse that you could talk to, and we can minimise some of the trauma and the worry that going for a smear test might make. These are simple points that we could do. These are simple points that could change lives. And I think I'm very supportive of lowering the age of smear tests for the reasons that I've outlined. But I also think that we owe it to the young women to give them the best protection that they possibly can have. Thank you, Chair.
Hannah Bardell.
Pleasure to serve under your chairmanship and to speak in this debate. I was supposed to be with yourself and others at the Council of Europe last week, but I wasn't because I was having a biopsy done because I had had an irregular smear. And it was an uncomfortable and painful experience, but largely made better by the fantastic doctors at St John's Hospital in Livingston. And I will come back to that. I will get the results in 3 to 4 weeks. Hopefully they will be all clear. But I think it's very, very important that those of us who have a voice use it, and when we can speak out and when we can encourage young women and also people, we must remember, in the trans community to go forward and have their smears done. I had a really fantastic conversation last summer with Joe's Trust, who spoke very passionately about the work that they were doing with members of the trans community. And I want to pay tribute to some of the organisations that work in this area. I have a charity in my own local constituency called the Michelle Henderson Cervical Cancer Trust. Michelle Henderson was the year below me in high school. I didn't know her well, but we occasionally attended the same house parties, and I knew her to be an incredibly bright and vivacious young woman. She was diagnosed at 26 in October 2010 with cervical cancer and died on her 28th birthday in October 2012. Her father, Willie Henderson, is the famous football player, and Michelle set up the charity when she was, not long after she was diagnosed. And Willie has continued her incredible work in her memory, and a couple of years ago I did the last leg, so to speak, 120 kilometres of the Camino de Santiago to raise money for that incredible charity. And too many women are dying young. And although I know that many of us feel we must listen to the health professionals, we absolutely must, but we also must consider the individual cases. And those of us like me who had irregularities picked up early on, well below the age that cervical smears are now being carried out in Scotland, England and the rest of the UK. And the Honourable Lady for Rotherham and also for Warrington North mentioned victims of sexual violence, and I just want to pay tribute to the work that My Body Back, set up by Pavan Amara, does. It was set up as a project which works with women who have experienced sexual violence regarding their physicality. The project started in August 2014 and supports women who've experienced rape or sexual assault to take their bodies back again. And they do this by running specialist services. They opened a clinic recently in Glasgow, including a cervical screening and maternity clinic. That work is so absolutely vital. And it's so vital because for those women who have been victims of sexual violence, it can be a harrowing experience to have to go and have your smear done. And I think it says something that the I've forgotten the name of it, but the thing that is used to open our speculum, thank you very much, has not changed. The design of it has not developed in decades, if not, longer. I think that says something about the care that is given to women's health. But from my own perspective, I was diagnosed with HPV, and for the rest of the world, let's remember that presents itself as genital warts in my late teens. I had intercourse at that point. I was not out. I had intercourse with a man and the condom broke, and he was good enough to get in touch with me and tell me that he had contracted, not from me but from a previous partner, HPV. So that was an experience that I have lived with for my whole life and has been a source of deep shame, because it meant no medical professional was ever able to tell me whether my irregular smears, and I have had many over the years and I have had much treatment for precancerous cells, was directly related to that experience or not. The positive part to that story is that a few years after my experience and after I was given the all clear, I was contacted by a big multi-conglomerate health company who were developing a vaccine to stop HPV. And they asked me, would I give my cells? And I said I was happy to do that. So I travelled back and forward to clinics over a couple of years, giving my cells, giving my blood. And it meant that my unfortunate experience, which is the experience, I'm sure, of many, many women, the length and breadth of the country, and is not something that we should be ashamed about, meant that some of my cells were used to develop the vaccine that is now given to many women and young girls across the country. And that is something that I'm very, very proud of. And I didn't plan today to speak about my personal experiences, but I figured that those of us who have a voice should use it. And we should absolutely say to women, at a time when cervical smears are at an all-time low, and there may be an element of complacency because we are wiping cervical cancer out. But as my doctor reminded me as she was peering over me and doing my colposcopy the other day, the vaccine only protects against 3 strains of HPV. And like all viruses, they have a habit of mutating. We must say to every person who should be getting their cervical smear how vital it is. And we must listen to them about the real and genuine concerns they have. And we must, as the Honourable Lady for Warrington North says, the terrible shaming of women's bodies that happens in the media absolutely plays a key part to why women feel and girls feel that they can't come forward. We must remind them that our bodies come in all shapes and sizes and they are all beautiful. And the only way that we can make sure that we prevent this terrible disease from killing any more women is to make sure that we get out there, we talk about it, and we encourage them to go for their cervical smears.
And Chapman.
Thank you, Sir Roger. It's a real pleasure to speak in this debate, particularly under your chairmanship, of course. But it's just great to be in a parliament where there are women who are prepared to stand up and share some of the most private, intimate things about their lives, probably things they haven't told their mothers, in a forum such as this. I will give way.
I thank the Honourable Lady for giving way. I do just want to say that when I went to the sexual health clinic in Edinburgh, it was my mother that came with me. She was the only person that I trusted. And yes, up until today, there was only about a handful of people in my life that knew that story.
Well, she sounds fantastic, and how lucky you are. But I do think that we're in an age now, which I don't think we were when I was first elected, even as recently as 2010, where women will stand up in Parliament and they will talk about the cost of Tampax and smear tests and their own sexual history and mesh, as my honourable friend never stops reminding me. It's a good thing. It's a wonderful thing, and I'm really proud to be a part of it. When I first saw that this debate was taking place, I asked for the data for Darlington because I just wanted to see where we stood, and anticipating, I'm afraid, what you normally get when you look at the North East health data and compare it to the rest of the country. But I was pleasantly surprised that actually take-up in the North East is better than it is in most other places in the UK. And that's a very interesting fact for me, and I think that part of that is around stability of communities and the ability to access services which are themselves stable. They don't tend to move around too much. GPs tend to serve for longer periods of time, and although there can be very many issues with access to services, it would appear that in this regard, at least, women in my constituency are availing themselves of the opportunity to get tested at a higher rate than they are in other parts of the country. And that, I think, is it's a very, very welcome thing. But something that I did notice when I looked at the data for Darlington was that the participation among 25 to 49-year-olds is fairly steady at around 74-75%. The take-up among older women, so those aged over 50 up to 64, has gone down 2% in the last year. And actually that seems to be the case in other parts of the country as well. So I do welcome the discussion today about young women and testing under the age of 25. I think that there is something to be mindful of, which is the message that we might be sending to older women that they don't need to worry about this anymore. And some of the reason, I think, that older women their take-up may be dropping off more quickly than those in other age groups. Obviously, there are the issues around embarrassment and indignity and all of that, although I have to say, at the risk of oversharing. Yes, I give way. Rescue me, Sarah. All right, sorry. No, I mean, it's just the only smear test I've ever had where I really did not care was the one that happened not long after I'd given birth to my second child, where, that was not an issue at that point. However, I am mindful of the fact that older women don't seem to be taking part in the way that we would wish them to. And some of that is the indignity, obviously, but also there's a lot of misinformation and misconception about cervical cancer. So I've heard people say that once you're no longer as sexually active perhaps as you may have been earlier in your life, or you may not have so many partners or change partners quite so often, that you are somehow at less of a risk or no longer need to be so concerned about cervical cancer, and therefore your need for a test is reduced. I've heard people say that if they're in a same-sex relationship, actually their need to have a cervical screening test is not, they don't need to have it. And there does seem to be this association between sexual activity and a risk of cervical cancer that I don't know where that's come from, and I don't know why it does seem to persist, but we heard it referred to by my honourable friend for Warrington North when she was talking about vaccination. And that kind of misconception seems to apply to older women as well. And I think if the campaign that the honourable gentleman opposite takes place, it's very important that those messages they take the opportunity to get those messages right too. My honourable friend for Rotherham made a very helpful point, I think, about women who've been victims of sexual abuse, and I think there is a very special concern that those women have, and it's entirely understandable, and it is something that the quite blunt approach you can get from service providers doesn't take account of, and absolutely more thought needs to be given to that. But in addition, I would also just remark that disabled people may have additional needs in terms of being able to access this test, and I am absolutely certain that not every setting will be able to cater for those needs in a way that does enable a disabled woman to have this test with the dignity and the sensitivity that we would all expect. But I do think that the declining participation in smear tests, that trend is something that should be ringing an alarm bell with ministers. I'm sure it is. This is it's a red flag data set. It's great that we've got this data, actually. It's fantastic to be able to debate something with really clear information so you can see good quality data over time, and we can get a fairly good idea about what's happening in different parts of the country. But we've got to use that to nip this problem in the bud before it gets even worse. I do think from people that I've spoken to that access to this service is one of the principal reasons, along with all the other things that we've talked about, why women aren't participating in increasing numbers, and instead we're seeing those numbers declining. The GP patient survey last year found that 28% of patients found it not easy to make an appointment over the phone with their GP to be able to see a nurse. It's a growing number. That's up from in 2012 when it was just 19%. So we've had many debates in this place about difficulty in accessing GP services. It's something that I know the government will be wanting to grapple with, but actually it's affecting these women. You know, it's a very easy thing to want to put off your smear test. You may get round to making that phone call, and then if it doesn't quite work the first time, it's quite a tempting thing to not quite get round to again for some weeks or probably months later. I think the work that Joe's Trust has done is absolutely phenomenal. You know, what a tremendous organisation that is. You know, really, really impressive. The data that they've got, the stories that they've got, the way that they're putting that across in a manner that everybody can access and understand, I think is fantastic. But they're finding that 1 in 8 women find it difficult or impossible to book an appointment for their smear test. That just can't be right. So, you know, it may be that actually women should be encouraged to access services, perhaps not through a GP, but through a clinic that's a specialist clinic, or maybe they can access contraceptive services at the same time. I know that's something that is now available in Darlington, where it's open sort of in the evenings as well, and it's a very, very good service. And I think that might be one of the reasons why participation rates in my constituency are holding up relative to other areas of the country. I mean, I do take the point about, obviously I do, about the age of screening must be related to science, but I do wonder whether this isn't one of those situations where if a young woman is encouraged to have a test and has a good experience at an early age, whether or not we might be able to prevent some of the misconceptions and the anxieties about it being a painful test, which it really, you know, doesn't need to be, and the indignity of it, which actually done sensitively, it isn't a particularly indignified thing to do. So I do think that we maybe need to give some thought about an early experience of a smear test could actually help bring up those participation rates for women as when they're over 25 as well. So there's an awful lot that we need to consider in relation to access to this test and for cervical cancer generally. This is an important part of it, and I absolutely congratulate everybody who signed this petition for doing so and for putting this in front of us, because you know, we've got an opportunity here to do something that would make the lives of my constituents and everybody else's so much better and safer. And I know that the Minister will be listening and thinking hard and want to do right by the people who signed this petition.
Mr. Matheson.
Thank you, Sir Roger. It's a great pleasure to serve under your chairmanship. I have to say it's a great pleasure to take part in a debate where there are so many thoughtful and personal contributions. And can I congratulate my honourable friend from Warrington North for a very detailed opening. I've been trying to get a debate on this subject for some time to raise the concerns of constituents and others who have been denied smear tests when they were under the age of 25, and as a result of that have not been diagnosed with cervical cancer. And my honourable friend from Warrington North has raised the case of a young lady who died, I think, towards Christmas from cervical cancer, who believed that if she'd been allowed a smear test earlier, it might have caught the cancer at an early age. My understanding of the campaign that is underway at the moment is not necessarily to extend the access to cervical cancer to all women under the age of 18. It is more simply that when a doctor believes that a smear test is necessary, such a test should be carried out. I know of one case of a young woman, Lucy, who lives in a neighbouring constituency to mine, who did have a history of cervical cancer, was given a smear test, and the lab did not even test the sample but destroyed it simply because she was under the age of 25. She went on, Sir Roger, to developed cervical cancer. She went for a private smear test, and it was detected. I'm happy to report to you, sir, that it was eventually cured, but not without the difficulties of treatment. My own constituency, Sophie, wrote, "I'm 23. I have 2 children, aged 5 and 16 months. When I was 17, I fell pregnant with my first son, and my midwife asked for a smear test a few months after I gave birth, as I was suffering from abnormal pains in my pelvis area. My sister had been diagnosed with cervical cancer that year, and my nan had sadly died from it a few years ago. So there is a family history. I wasn't given one due to my age. 3 years ago, I was suffering from pain again, and they refused a smear test again due to my age, but used a cotton wool bud for a swab. This came back with abnormal cells, and I was given antibiotics to clear these up and take the pain away. The doctor advised me if it carried on, I would develop cervical cancer, and I may not be able to have further children. However, he did not refer me for a smear. I had my daughter," my constituent continues, "I had my daughter in June 2017 and still suffer from strange pains, and again my midwife asked my doctor to refer me, but my age has always been a massive problem. I'm 23, I have 2 kids, I'm a law student, and it's always in the back of my mind that due to my previous abnormal cells, which they didn't look further into, and my family's history, I could potentially have cancerous cells I don't know about, which would completely ruin and change my babies' lives." She concluded that I totally back me, Chris, with this, and I hope that this legislation is changed. It's totally against women's human rights and discriminatory in age. So the proposal is that women should have access to cervical smears if it is needed under the age of 25. The objections to this suggest that smear tests too early may be inconsistent and inaccurate and throw up false positives, as the honourable members have mentioned. But I say again, this campaign is not about testing all young women by extending the testing programme to 18 to 24-year-olds, but only allowing them where the circumstances require a test. And my honourable friend from Warrington North talked about the regulations currently in place, which she believes are not being implemented. The regulations behind the 25 years age limit are now 13 years old and haven't been reviewed in that time. Again, my honourable friend called on the Minister for a review of the current regulations. The Smear on Demand campaign have prepared an extensive research paper that shows that the initial figures used 13 years ago to justify that 25-year age limit may have been incorrect. The research only used figures from when patients were diagnosed with stage 1B onward, as opposed to stage 1A. Many of the high-profile cases we hear about today were initially diagnosed with stage 1A. They've looked at the figures. The campaign has looked at figures for women under 28 and women being diagnosed with stage 1A as highest in women aged 25, and the figures only start at 25 and are not collected before then. The smear test is supposed to be a preventive measure, but women can only access it at 25, so it makes no sense if the lower age limit removes the possibility of prevention. I don't think it's in dispute, Sir Roger, that 25 is a good start for routine smears, but where a doctor believes that a woman under 25 needs a smear test, that should surely be allowed on the NHS. This campaign is not asking that all women under 25 get tested, just those where a doctor wants it. 99.7% of cervical cancers are treatable, because I'm informed that it's a cancer that goes through 3 stages of pre-cancer. It can be very slow growing, and a smear test is the only cancer detection test currently available that can detect pre-cancers. Can I say to the Minister that I welcome the Secretary of State's commitment to prevention in the NHS strategy that he presented to the House recently, and I also welcome the commitment he gave to me at that time in the main chamber to ask Mike Richards to look into this. I haven't actually heard yet from Sir Mike, but I'm sure he'll be in touch soon following the Secretary of State's promised that he would do so. So, Roger, I'll just finish on this point. The House is currently dealing with some very difficult, intractable and divisive issues. This isn't one of them. This is an easy issue where a minister can perhaps change the regulations and direct that if a doctor believes that a young woman under the age of 25 has symptoms that require investigation, that those are being investigated. This is a minor change that could have major consequences, and in these difficult times I would urge the Minister to apply common sense and grab that chance with both hands.
Emma Hardy.
Thank you, Sir Roger. It's a pleasure to serve under your chairmanship. And thank you to everybody who signed the petition and to all the women who have come here today to listen to it. I know it's getting down to London can be quite tricky. I say that because I come from Hull. But thank you all for coming, and thanks to everyone who signed it. And I agree that, having a smear test isn't pleasant, but I think we'd all agree it's very crucial. And while we're in a sharing mood, I'm going to do a little bit of sharing as well with you all. Because I too had abnormal smear tests and was found to have precancerous cells when I was in my early 20s. It's when I just finished university and I, at that point, had decided to move to Leeds to spend time with my sister. And they found them on me. And it was fine. I had the biopsy. They had to remove the cells. I went through the various bits and pieces of the operation. And since then, I have been on a yearly recall. So I've had so many smear tests. Since then, they keep telling me each time, I say, do I need to still be on a yearly recall? So, we'll let you know. And the next year, bang, there we go, back. So I'm due back again, and this has prompted me to pick up the phone and do that. And I also, didn't take my mum with me, unfortunately, because she was unable to come. I took my younger sister, who's 5 years younger than me, and I was only about 21, 22. It terrified her when having to go through the experience of coming into what she was there to be my moral support, and I found myself through the operation I was having saying to her, "Don't worry, it's fine, I'm perfectly okay," and reassuring her throughout it. And I think we should be a bit more open and honest about these things, and I think we should also do that brilliant thing that we all do when we get a little bit embarrassed and laugh about it. And actually, it can be quite comical. And as I say, I've had so many of them, and my friends have been a bit worried about them. I sort of joke about the fact that, you have this ridiculous small piece of blue towel that's meant to preserve your modesty. And it's like, when all the rest of you is exposed to the world, but, your midriff is hidden by the piece of blue towel. And it's funny. And it's also quite funny when I went not long after being elected and I was laid there and someone went, "Are you our local MP?" And I said, "Oh, yes. Yes, I am." Which then preceded a conversation about how was I finding life in Westminster. Well, slightly more comfortable than this, thank you very much. And we should find it funny and we should laugh. And I feel while I'm also in the mood of sharing, I have a little tip for all the women out there, that if you have a hidden cervix, apparently mine's quite shy, if you suffer from this as well, towel or cushion under the bottom, lift it up, it comes into view. So a little bit of health advice while I'm here as well. Because in all seriousness, there is a problem, and it's a growing problem. And in Hull, we've dropped to only 73.1% of women having their smear tests now. I mean, that is a huge fall. And it's slightly higher in the East Riding, around 78%, but nowhere near the 80% that the NHS are going for. And I absolutely want to echo the words of all of my honourable friends and honourable members in saying that I think the government needs to do some kind of surveying to find out why. Why is it? Is it a problem, as my honourable friend said, that they associate it with sexual activity? Is it that they don't think that it's something they need to be involved with? Is it because they're working different hours and not able to attend? Let's find out and let's make life that bit easier for all of them. Because we know, when you look at the NHS cure rates, that 92% amongst those whose cancer was detected are cured, and that's wonderful. I mean, how could I possibly say what would have happened to me if mine hadn't been removed? I don't know, but I'm here today and all is well and will book that smear test. And 66% of all those diagnosed after developing symptoms are also cured, and we need to do more to sort of push this message out to people and get rid of all of these myths. So I absolutely support the beautiful speech by my honourable friend about the importance of reducing it to 18 under the doctor's advice. But I would also, like the Minister, this is a campaign which I've been involved with actually through the education side, which is to teach menstrual well-being in schools, because I'm not sure that everybody does understand what the abnormal signs are or what the abnormal symptoms are. And I actually started to become involved in this campaign through my support for Endometriosis UK, which is a charity. But I think this would also help a lot of people in terms of smear tests, because if we remove the taboo about periods and about smears, about all of it, and we start talking in school about menstrual well-being and what are abnormal periods, what are normal periods, what are abnormal symptoms, what are normal symptoms, if we start having that conversation and we give people the language and the ability to talk about this without feeling really shy about going, got a problem with the... We can't say the word. And And we should be able to talk about it, which reminds me of a brilliant quick story. When I was doing a radio show about my campaign about vaginal mesh, and I spoke to the producer on the show before I was due to speak live, and he said, we're very supportive of the campaign, but it's a breakfast show, Emma, so could you not mention the word vagina? So I spent the entire interview talking about problems with mesh that was in women's bodies. And I think we need to dispel all of this nonsense and all of this shyness and start being a little bit more open. And so I'd implore the Minister to work with the Minister for Schools in supporting my call for menstrual well-being being taught in schools. And I'll give way.
Giving way, and I just absolutely want to agree with what she's saying about the fact that we can't talk about our bodies and the parts of our bodies for some reason at that time in the morning, in the same way that I still find it incredible that adverts for sanitary products depict women's period blood as being blue rather than red. And I don't know about anybody else, but I have never bled blue in my life.
Maybe that's royal family only, who knows? But you're absolutely right, though. I spent years being convinced that if we used Tampax, it would suddenly make me more fitter and active and able to roller skate. But I would... sorry. We're descending into farce here, aren't we? But I would, on a serious note, ask the Minister to please look at what my honourable friend said, lowering the age to 18 for doctors who give the recommendation, and also please support my call for menstrual well-being being taught into schools and a wider survey and understanding why people are not attending so that we can do something to change that for the future. Thank you.
Angela Crawley.
Thank you, Sir Roger Gale. It's a pleasure to serve under your chairmanship, and I am, of course, grateful to be able to speak in this debate today. I thank the Honourable Member for Warrington North for bringing forward this debate, and I wanted to first of all welcome everyone who's here in the gallery today. I'm sure Natasha's friends and family who are here have definitely brightened up the gallery and brightened up this debate, so we're grateful to have you here. I want to start my contribution this afternoon by paying tribute to Natasha Sale, a brave young woman who organised this petition, which we are debating today. Now, Natasha, as we've heard, was diagnosed with metastatic cervical cancer before passing away on New Year's Eve last year. A 31-year-old woman who left behind 4 children. So it's incredibly sad to hear that she never got to see this moment through. But I hope that by having this debate today, it pays tribute both to her tenacity and her commitment to making sure that this was heard, because she wrote herself on the petition website, if I can do anything with my life, I want to make this change happen. It's too late for me, but it's not too late for the next generation of young ladies, and I think that's a truly brave statement. So I'm only sorry that she could not make it to this point to see this campaign being debated on the floor of this House, but we are very, very grateful to have all of you here. Her bravery and her selflessness until the last in the face of this horrendous disease is truly humbling and should be commended by all. Now, in doing so, we must also recognise the commitment of her family and her friends who continued her endeavour to reach more than 100,000 signatures on the petition, which is a feat in itself. In raising the awareness of cervical cancer through their campaign and encouraging women to take smear tests, they have undoubtedly already saved lives. Now, breaking the taboo is so important in the fight against cervical cancer, and this debate should not only serve as motivation to every young woman that is scared to get regular checkups and to go and see their GP, but it also, and I'm sure it has reminded many of us, to also never be too busy to do the same. Now, the contributions from honourable members across this House are most welcome, and it is always a pleasure to have men speak in these debates, because as the honourable member for Darlington rightly pointed out, for too many years in this House, these issues have been seen as women's issues, and they're not women's issues, because even every man has a mother, has a wife, has a daughter, has a sister. So this is a discussion that everyone should have, and it is most welcome to have those contributions. So I wanted to take the opportunity to summarise firstly some of the contributions. The Honourable Member for Chester both raised the constituents' cases in his own constituency, and especially the case of the young woman who sadly died before Christmas this year, because she was denied access for being under 25. I think that's a great sadness that she won't also be here at this point. The Honourable Member for Darlington rightly highlights that this is a debate that should be part of everyone's agenda, both to highlight on behalf of their constituents, but also to raise awareness that this is not just a women's issue. And I join the calls from the Honourable Members for Warrington North and Henley, who called on the Government to keep this under review. Now, the Honourable Member for Kingston upon Hull brought a bit of lightheartedness to the debate, and I think it is important that, as harrowing and awful as this is, we do need to find a way to laugh. I also find myself in a similar position where up in stirrups and being told, oh, that's where I know you from. It's probably easily the strangest time to be recognised and a little bit weird. But I did go and get my smear test nonetheless. The Honourable Members for Kingston upon Hull, Rotherham and Livingston gave very personal contributions, and the House is always richer when people are able to share their own personal experiences and to give a voice to the many, many more women who don't have the platform. So I'm grateful to each and every one of you for sharing those contributions. They were deeply personal, but we appreciate your honesty and your candour. And I want to pay tribute to Joe's Trust, especially because they have actively sought to ensure access to GP services, and I think that's especially important, as much as it is here across England, but in Scotland as well, that people know that they can access these services. Now, cervical cancer is the most common cancer in women aged between 25 and 35 years old, and I find myself in this bracket. So for every young woman in Scotland right now, I want to use this opportunity to please encourage you to go and have your smear test. If it's been a while or if you've never done it, now is absolutely the time. With around 6 women in Scotland diagnosed every week, I think I want to take this opportunity just to please don't be scared, go and have that done. It's so important. We know that smear tests are the best protection against this form of cancer, but yet it isn't the most comfortable experience. It's not the nicest experience, but it does have to be done, because if it can be done, it is estimated to save around 5,000 lives each and every year across the UK and prevent 8 out of 10 cervical cancers from developing. Despite that quite remarkable figure, the most up-to-date figures, as we've heard, show that 73% of eligible women are accepting the offer, but that ultimately means the other 27% or 17% are not. That means 27% of eligible women are missing out on potentially this life-saving trip to the doctors, and I've heard some of the reasons why people are avoiding participating, and we heard rightly from the Honourable Member for Warrington as well. But I think to say that this is intrusive or offensive or scary or gross, it is not a pleasant experience, but it shouldn't be a reason not to. And while it is true that there are more fun things than getting a smear test, the same could be said about a number of routine checkups. I don't particularly like going to the doctors or the dentist, but, it's important. And what is also clear is that more work has to be done to encourage the take-up of screenings amongst certain groups of the population. As we've heard earlier, evidence shows that there's a lower percentage of participation in cervical screening among young women living in areas of deprivation and women with a learning or physical disability, black or minority ethnic women, and lesbian and bisexual women, because it is a myth that those women, myself included, think that you should not have to have a smear test because you're sleeping with someone of the same gender. Especially as my honourable friend rightly highlighted for those who are trans also. I think it's easy to assume that this is just a women's issue, but it's an everyone issue, as I've said. In Scotland, we are working hard to ensure that all those at risk see the importance of attending cervical screenings through public awareness campaigns, tackling the fears that people may have about having a smear test. But the contrast still remains that the most apparent amongst the most and least deprived are ultimately those who are the most deprived who are less likely to attend, as 78% of women living in the least deprived areas attended their smear test, whereas 67% took up the offer in the most deprived areas. I hope the Minister will recognise that and look at what they can do to also raise that awareness in these areas. This proves that we have so much work left to do. Now, in Scotland, we are introducing checks for HPV within the routine smear test, allowing for earlier detection and more effective treatment. and Health Scotland have produced a toolkit to help GPs, practice nurses and practice staff to optimise uptake, reduce barriers and ensure women are making an informed choice about cervical screening. Despite those efforts, in a recent study, 72% of young women said they delayed a test or never went for the screening because they felt embarrassed. Now, I don't know about anyone else, but I dread to think of the notion of the statement dying with embarrassment being truly the case in this instance, so I hope that we can do more to recognise that young women should not feel embarrassed, they should not feel ashamed, and we absolutely must do more to encourage women to get for their screening. Because if we can break the taboo, we will save lives. Now, February the 4th marks World Cancer Day, so I think we should use this opportunity once more to raise greater awareness and encourage women to come forward. And I think we should use this platform, this House, to not just speak about Brexit, but to use every other opportunity, to tackle the issues that affect women so much. And I'm sorry to raise it in this debate. Thank you.
Thank you very much, Sir Roger. It's a pleasure to serve under your chairmanship this afternoon. I want to start by thanking my honourable friend, the member for Warrington North, for bringing this debate forward today on behalf of the Petitions Committee, as well as others have done, pay tribute to Natasha Sale, who started this important petition, and echo what others have said about how sad it is that she didn't live to see this debate take place today. Her family, I'm sure, are very, very proud of her. I would also like to thank all other honourable members who've spoken in this debate, the member for Henley, Rotherham, Livingston, Darlington, Chester, Kingston upon Hull West and Hessel, whose speech we will not forget anytime soon. It was excellent. And the member for Lanark and Hamilton East, who speaks for the SNP. It's been an excellent debate with very good contributions and lots of sharing. And as a classic oversharer, I am going to resist the urge. I'm going to try. Finally, thank you to the 167,000 people who have signed the parliamentary petition so far. It's a very timely debate as well, Sir Roger, as Cervical Cancer Prevention Week concluded only yesterday. And I know that this is also a very emotive issue, the actual issue we're debating around the age of that screening starts. Every year in the UK, over 3,000 women will be diagnosed with cervical cancer. And as we've heard, 15% of these will be aged under 30. And last year, 12 of those under 30 died from cervical cancer. However, the number of cervical cancer deaths has fallen in recent years, but it remains the most common cancer in women aged 35 and under. And that is why I welcomed the preventative measures such as the Hpv vaccination, which was introduced over 10 years ago and offered to adolescent girls in secondary school. And I know that my daughter was one of the first to receive it when she was 13, and I was very pleased to give that permission and wouldn't have hesitated for a second not to give that permission, although my honourable friend raised the issue that a number of people do, which is very concerning, as much as they will no doubt have genuine concerns that has led them to that decision. Perhaps we need to try and do what we can to allay any fears that they have. And there was also, as we've heard, a catch-up programme at the time to ensure that all girls were vaccinated up to the age of 18. At the time, following a similar campaign by a Washington constituent, Claire Walker Everett, and her family, which Claire led before her untimely death at the age of 23 in 2008, and which her family continued for some time afterwards. That led me to look into this policy area back in 2008 extensively, and at the time I called for a further catch-up programme to address what I called the 7-year gap, so that women aged over 18 and up to 25 could be vaccinated until the time they were eligible for smear tests. This gap, I said at the time, would close each year until almost all under 25, as we find now, have been vaccinated. So, thankfully, it's 10 years ago, so this gap is now closed. And 10 years on, many of those first vaccinated will now be approaching 25 and will, in their own right, be eligible for a smear test. So, we should have a whole generation of young women and girls who have mostly been vaccinated against the HPV virus, which helps protect them against cervical cancer. And the vaccination programme has been, on the whole, very successful, with a high uptake nationally of around 85%. However, there are significant regional differences, which I know I've raised with the Minister before, when it comes to the uptake of the HPV vaccination, and I think that this is something that needs to be addressed. The lowest uptake level for the 2 doses is in Stockton-upon-Tees at 48.3%, compared to the highest level of uptake in East Renfrewshire at 95.6%. So this is really curious, because it does fly in the face of the screening stats, which honourable members have cited, that showed that the North East was actually higher than some other areas. So perhaps it's just pockets rather than whole regions. But I therefore ask the Minister what steps he has taken to investigate and address these regional inequalities, that's both with HPV vaccination and screening. So how is the government ensuring also that the HPV vaccinations are being taken up by the vast majority of girls? So as otherwise, the reassurance of my earlier statement about a whole generation of women and girls approaching 25 having been vaccinated falls short in certain areas, which is extremely concerning. Similarly, cervical smear tests are available to women aged 25 to 64, yet cervical screening, as we've heard, is at an all-time low, 21-year low. Last year, it was discovered that over 40,000 women had missed out on receiving crucial information relating to cervical screening, appointment and test results. Has the Minister made any assessment of the impact this has had on uptake? And can the Minister please give assurances that this issue has now been solved? According to Joe's Cervical Cancer Trust, who I also commend for their tireless work in campaigning, 1 in 4 women across the UK do not attend cervical screenings, but the proportion increases to 1 in 3 amongst those aged 25 to 29 when they're first eligible for the screening, and then 1 in 2 in some of the most deprived regions in the UK. And the reason for this decline can be for a host of reasons, such as fear or embarrassment, as we've heard. I pay tribute to TV shows such as the Victoria Derbyshire show, who often show the medical equipment involved with the smear test, and even showed a smear test live on the TV show on Friday in an attempt to address this. And there was no real wincing or obvious pains, there was no cries of pain or anything. I think that for someone who hasn't had one, that would be really reassuring. Although I'm sure some viewers probably complained that it wasn't suitable daytime viewing, but there we go. So can the Minister, aside from conducting more trials such as that, tell me what steps he's taken to increase take-up? Additionally, what steps is he taking to educate women on the need for cervical smears and what the tests are for, some of which honourable members have also touched on today? For example, I understand that some women believe that a cervical smear test will also detect ovarian cancer, which, as he knows, is not the case. So, coming to the screening age, as I've already mentioned, most women under the age of 25 will now have received the HPV vaccination, giving them excellent protection from the HPV virus. So, the reason that may have once existed to lower the screening age no longer does. Although I will say again, this falls down when looking at low take-up areas. Additionally, I worry that lowering the eligibility age for a cervical smear test to 18 would cause additional problems and worries for young patients, as was detailed so well by my honourable friend for Warrington North in her excellent opening speech. False positives are more likely in younger women, as they often undergo natural and harmless changes in the cervix that a smear test would identify as cervical abnormalities, and in most cases these abnormalities resolve themselves without any need for treatment. Treating these false positives as cancer can damage the neck of the womb, which can cause a woman to give birth prematurely in any future pregnancy. In women under 25, therefore, it is deemed the risk outweighs the benefit. But as my honourable friend for Warrington North said, this information should be provided to women to make these comparisons and judgments for themselves, along with the wider education starting in school, as my honourable friend for Kingston upon Hull North and Hessel called for, to start as early as possible to try and tackle this fear and embarrassment at a young age as possible. And I also believe that there should be much more research into this issue of the age, so that a decision can be made that is best for all women. Finally, cervical cancer in women under the age of 25 is very rare, with less than 3 cases per 100,000 women. However, each one of these is an awful ordeal for the woman and their families, and in some cases becomes a tragedy, as we've heard with Natasha Sale, but also with the case in my constituency that first brought this to my attention with Claire Walker Everett in Washington in 2008 at the age of 23, and more recently Amber Rose Cliff from neighbouring Sunderland Central constituency in 2017 at the age of 25. So therefore, if a young woman has abnormal bleeding or worrying symptoms that she is concerned about, she should be taken seriously by her GP and be offered a smear test as soon as possible as part of other health investigations into what is causing her symptoms. And I understand, or I believe, that this was current guidance and best practice, but as we've heard clearly in this debate, this is not always followed, as was the case with Amber Rose Cliff, who went to the doctors. In her short life, she died at 25, she went to the doctors around 30 times since the age of 18, complaining of worrying symptoms and asking for a smear test, to be told 30 times she was too young and sent away. By the age of 21, so that was over 30 times over 3 years, by the age of 21, Amber's mum paid privately so Amber could have a smear test, which showed devastating results. It was cancer, and the cancer had spread. She died just 4 years later, aged 25. Now, young women should not be excluded from a valuable screening service if they have symptoms, as she obviously did, just because of their age. GPs should therefore be aware of cervical cancer symptoms and know that they should refer for a smear test as part of wider investigations of their young patients that present with such symptoms. So with all that I've said in mind, I conclude that the age for cervical smear test should remain at 25, on the provision that further research and debate is carried out, as well as tests offered to those under 25 who present symptomatic. The government must also ensure that preventative measures such as the Hpv vaccination are taken up as fully as possible, and also ensure that women eligible for a cervical smear test attend their appointments when they are invited or as soon as possible thereafter. I know the Minister kind of personally dragged them all there, but anyway, I look forward to the Minister's response. Thank you.
Minister.
Thank you very much, Sir Roger. It's a pleasure to serve under your chairmanship again. I shall refer to you again in a moment. I feel somewhat outnumbered in this debate. The gentleman from Chester and the gentleman from Henley and I. But I'm rather used to that, having chaired the all-party group for breast cancer for 5 years with my shadow opposite from the Labour Party, was often referred to as Steve and the Girls. And I'd just like to completely endorse the point that the lady from Lanark and Hamilton East made, is that this is not a women's issue. And in fact, Natasha, who I'll come on to in a moment, has 4 children, 2 of each. So it's very much a boys' issue for them. And it's very much a boys' issue across the board. We may have only heard the B word once during this debate, Mr. Gale, but I could have sworn I just heard something from outside. I must be imagining things. It has been a privilege to be part of this debate. It's only right that I start by expressing my sincerest condolences to the family and friends of Natasha Sale, who obviously tragically passed away in December. I'm sure, I know, indeed, I speak on behalf of all members present when I say that our thoughts are with the family and the friends during this time. Anybody who's lost a loved one to cancer knows the pain and anguish that the family are experiencing at this time, and due to Natasha's loss. And as somebody who has fought and lost more than I've won, I'm one of those. I was interested in looking at some of the coverage around Natasha's death, and I saw a quote from Amanda Scott, who's her best friend, who said, "God only takes the best," which I thought was a lovely quote, and we've heard that many times before, but it was interesting how that was reported. Now, as the Public Health Minister, Cancer Prevention, and the Cancer Minister, obviously cancer prevention and early diagnosis are absolutely vital priorities for me, and I want to assure that the family and Natasha's army, who are here today, delighted to see them all here. I saw the pictures on the bus on social media this morning with some interesting hand signals, but they are must ask them about that afterwards, Mr. Gale. But it's very, very good to see them all here. And I hope that they know, as do members in this House know, that I will continue to wholeheartedly support the efforts of the NHS and Public Health England, who I obviously hold to account as the Minister, and all of our excellent cancer charities who work to prevent cancer and be part of Team Cancer and to reduce the number of families from going through what they're going through. There have been so many interesting speeches, and luckily for once I can say that I've got time to touch on a number of them, if not all of them. The lady from Darlington, very interested to hear her point about the data from Darlington. And the take-up being better in the North East than almost anywhere else. So I was really interested in what she had to say about the reasons behind that. I think we as a system, or the NHS as a system, too infrequently does it talk to members of Parliament who actually know their areas better than most. And I will ask Sir Mike Richards, who I will come on to during my speech, to contact her. And very happy to facilitate that, and maybe she would like to do that with the Honourable Gentleman from Chester, who is obviously still waiting for said introduction. The other point she made was around access, as many have made, and I thought it was a very good point she made around disabled women. I will ensure that this is fed into Mike's review, Sir Mike Richards' review, and I would encourage her to raise that with him when she sees him. I'll come on to the lady from Warrington, who obviously introduced the debate on behalf of the Petitions Committee, because many of the points that she raised do come up in my speech, and I will reference them. My honourable friend from Henley talked about the Be Clear on Cancer campaign, and I'm very pleased that he has mentioned that, and the new Public Health England campaign that will be being rolled out this spring, next month in fact, and the GP's role in that. I mean, the Be Clear on Cancer campaign is a public-facing campaign. It is aimed at members of the public, but there are elements around GP education, which I will come on to, and I thank him for raising it. He often raises very good points in these debates, so I thank him for that again. And also the lady from Rotherham talked about the GP's understanding, and I will touch on that. The lady speaks for the SNP, or speaks from the SNP benches from Livingston, made a very good, very personal speech, and I know she says she's awaiting results, and I think I speak for everyone when I say we wish her well in that. We will be thinking of her, and our fingers are crossed for her. And she made the point about the trans community, which I've not heard mentioned in this context, this debate before. So NHS England has published clear guidance for trans men, who've changed obviously from female to male. Trans men who still have a cervix and have not had a hysterectomy remain entitled to screening. If a trans man is still registered with their GP as a female, they will continue to receive invitations for screening. If registered as a male, they remain eligible for screening but will not be invited automatically, is the situation. The guidance makes clear that trans men will need to request screening from their GP. But I thank her for raising the point, and it's another point that I want to feed into the screening review that Sir Mike is doing. The Honourable Lady from Kingston upon Hull, as always, makes a brilliant speech. She should be on the stage. I have to say, her rather unconventional MP advice surgery that she talked about possibly may not catch on, but I like to hear it, and it's one of those instances that we as constituencies MPs all dread when somebody says, "I'm sure I knew you from somewhere." She talked about education and in schools particularly. So Public Health England has got a range of materials that are aimed at teenagers and their parents to provide information about the HPV vaccination programme, for instance. But also she will know that the Department for Education are now working on the new RSE guidance, which closed in November, and that guidance, which will include Health Education England's input, will be published in the first half of this year. I actually took the Teenage Cancer Trust and Copper Phil, which is a breast cancer charity with possibly the best name in cancer charities, to see the schools minister, the member for Bognor, at the end of last year. And we're very keen to make the point to them that we must improve awareness in schools around health, around bodies, and particularly around cancers, but doing so in a way that balances the need to educate children about warning signs and highlighting that without frightening the life out of them. And I think we've struck that balance, actually, and I think members will be pleased when they see that guidance rolled out in the first half of 2019. And at this point, I should give way to the lady from Warrington.
I'm grateful to the Minister for giving way. Can he let us know whether that guidance includes educating young girls about the need to go for smear tests? Because the point has been made forcefully to me by some of Natasha's friends that if we do that, that may encourage them when they reach the age for screening to go.
The truth is, I can't. I'll find out, and I'll write to her and other members who've been in the debate today. I'll copy into that. It's not my policy area. Obviously, I'm not schools minister, but it's a good point she makes, and it would seem logical that she does that in consultation, of course, with the department and with Health Education England. Now, the gentleman sort of goes to the heart of where I want to start from. The City of Chester talked about a constituent and being refused smear tests. So his example. And he said, it'd be a very, very simple thing for a minister to just change the regulations. The system not doing what we already direct it to do. We do already, absolutely, as my shadow lady from Washington, the system absolutely should be doing that. And I'm not going to get into the individual instances because I don't think that would be appropriate. But, it's important to understand that cervical screening is a screening test, not a diagnostic test. So it aims to detect abnormalities of the cervix. So that if left undetected may develop into cancer. So it's therefore preventative. So cervical screening is not appropriate for women with symptoms, but if women of any age, including those under 25, have unusual symptoms, usually abdominal bleeding, they should they should consult their GP immediately, and they should be treated under the NHS and initially offered a speculum examination in accordance with the NICE guidance for primary care. So I would say to him as a constituency MP, if that is not happening, and that was one of my constituents, I would be taking that up through the procedures that he will know, obviously, as an experienced constituency MP. And I think that's pretty clear, actually. But I mean, and he also to touch on the fact that the petition doesn't. What the petition asks for. I mean, just to be clear, the petition is titled Lower the Age for Smear Tests from 25 to 18 to Prevent Cervical Cancer. But he's absolutely right to raise the point about women requesting that. And no decision about me without me, something we don't often hear in this House these days, but it's still very much alive, and I would encourage him to take that up, as I would any other members who run into that issue. Of course.
Minister for giving way, and I wonder if in his remarks he might address the issue of self-screening kits for HPV. I'm sure he's going to go on to talk about those. My interest is at the other end of the spectrum, women aged over 64, but it's very pertinent as well to young women aged 18 to 25.
Minister.
Yeah. Indeed. And if she's not satisfied with what I can give her, then please do come back and we'll make sure that she gets more stuff after the debate. I think it's true to say that self-testing in this area is an emerging area of medicine. It's not in the same place as the FIT test is, for instance, around bowel cancer. But it is certainly an emerging and I think quite an exciting area of policy. It's certainly something that Joe's Trust, who I would echo all of the positive words that have been said about Joe and Joe's Trust and Rob Music, who runs that charity. So members will be aware that the NHS, hello Mr Austin, that the NHS offers cervical screening to all eligible women aged 25 to 49 every 3 years and to those aged 50 to 64 every 5 years. Now the screening is designed, as I said, to detect abnormalities of the cervix at an early stage so that women can be referred for effective treatment. It's very important to remember that the purpose of population screening is to reduce mortality and morbidity from cancer. That is why we do it and other conditions in people who appear healthy and have no symptoms, by detecting conditions at an earlier, more treatable stage. Hence, prevention is better than cure. Now, of course, the purpose of any screening service is to maximise the chances of healthier outcomes and, by association, minimise the risk to harm of the whole population. With this in mind, Mr. Austin, the UK National Screening Committee considers the evidence on whether population-level screening should be offered and makes recommendations to us ministers. It is not ministers that make this stuff up, and nor should we. Using research evidence, therefore, pilot programmes and economic evaluation, the NSC, the National Screening Committee, assesses the evidence for programmes against a set of internationally recognised criteria. Now, it is, of course, important that these recommendations are made by experts based on the best available evidence and, as I say, not politicians. So on this basis, the UK NSC recommended in 2012 that women should be invited for their first cervical screening at the age of 25. Now, this recommendation was based on evidence that showed the majority of women below this age would receive little benefit from being screened and treated, which can lead, as we've heard from other speakers, to unnecessary treatment. And it's very rare that cervical cancers occur in women under 25. As my shadow said, less than 3 cases per 100,000 women. But, you know, if you are one of those 3 per 100,000, obviously with the ultimate cost, as in Natasha's case, then it is no consolation. But I'm only setting out the facts as they are here. So younger women, as has been said, Mr. Austin, before you were in the chair, often undergo natural and harmless change in the cervix. It is part of our physiology, and screening could identify as cervical abnormalities. In most cases, these abnormalities resolve themselves without any need for intervention. It's worth saying also that the recommendation that the NSC picked up in 2012 also concurred with a major review by the Advisory Committee on Cervical Screening back in 2009. So this advice does go quite a long way back. Now, the lady from Warrington asked me whether the NSC would publish its evidence on decision to screen from the age 25. So the NSC publishes minutes of all their meetings and full rationale behind any recommendations. I will, however, ask Public Health England and the UK NSC to publish any relevant evidence used by the NSC in reaching its conclusions and on which they base their recommendations, not already in the public domain, which I hope she will be pleased to hear. Let me talk about HPV primary screening, Mr. Austin. It goes without saying, every life is precious, and we cannot, and I think those who know me know that I am not, complacent in continuing to do all that we can to prevent cancer. So we're therefore modernising the cervical cancer screening programme by introducing the detection of human papillomavirus, HPV, as the primary test in the NHS cervical screening programme. I can confirm that this will be implemented across England by 2020. Cancer Research UK estimate that when fully implemented, HPV primary screening could prevent an additional 600 cancers every year. Almost all cervical cancers are caused, as we've heard, by HPV, a very common sexually transmitted infection which is linked to the development of the disease. So in addition to changing the primary test in the cervical screening programme itself, Mr. Austin, I also want to highlight that vaccination against HPV, introduced in 2008 under the previous government, is now routinely recommended for all girls aged 12 to 13. The first dose is offered in school year 8 in England and Wales, and the aim of the programme is to prevent cervical cancer related to HPV infection, and the best way to do this is to vaccinate girls and young women. So we're fortunate to have achieved good uptake of the HPV vaccination in adolescent girls since 2008. The first cohort of teenage girls to receive the vaccination in year 8, so those born in September 1996, will turn 23 this year and become eligible for routine screening in 2 years' time, as my shadow said. And it will, of course, be of intense interest to all of us to see what impact the vaccination will have on the number of abnormalities detected through routine cervical screening, and we'll be monitoring this very carefully. I will be watching it like a hawk, as you would expect. And we've already seen that the vaccine has led to a reduction in HPV infection in young women, and we anticipate a fall in the numbers diagnosed with cervical cancer at age 23 to 24 in this year, 2019. Now, it's also worth saying, Mr. Austin, that whilst boys have received a level of protection from the girls' vaccination programme over the last 10 years, and we've had debates in this House, and the reason I referred to the previous chair, Sir Roger, is that he led a debate in this House around HPV vaccination for boys. And there was a lot of debate around that. There was a lot of people who said, well, the boys get herd immunity, and therefore they don't need the vaccination programme. I have to say, again, I'm led by the evidence. I'm led by the advice that I'm given. My personal view was that I didn't buy that herd immunity argument. So I was pleased when the advice was something that I also agreed with. So from September 2019, all boys, and this is the point the lady from Rotherham wanted to see, I know, I actually announced before Christmas that all boys aged 12 and 13 will also be offered the HPV vaccination against HPV-related diseases such as oral, throat, penile and anal cancer, and this will help reduce the incidence of HPV infection circulating in the population. And it's worth saying that HPV infection, of course, is the primary cause of cervical cancer, but there are many other cancers, head and neck cancer, that we will see a long way down the line. Without wishing to be too delicate, Mr. Austin, I am told that the incidence or the popularity of oral sex means that the HPV vaccine will have a big impact in the incidence of oral cancers. And as the dental minister, I often hear from the dentist that this is a growing problem in our country. So I'm pleased that we'll be able to make what is a very positive and I think well-received policy response to that. But as has been said by the lady from Warrington and the lady from Rotherham and other speakers, that there are plenty of people out there who disagree with HPV vaccination. And whenever I speak about this subject, and I can feel the tweets landing in my inbox as we speak, whenever I speak about this subject, I open myself up to those who vehemently disagree with this. All I can say is, I think you're wrong. I think the evidence suggests that you're wrong, and this is a free society, and you are, of course, entitled to that opinion, but we base our policy decisions on the evidence, and the evidence is where we are. So what I've said about the HPV vaccination for girls and now boys is very important, but let me just reiterate the message that it's still so important, of course, that women who've had the HPV vaccination attend their cervical screening appointments when invited. It does not turn you into Wonder Woman. Now, the lady from Washington and Sunderland West asked me about what we're doing to ensure education for young adults on HPV vaccination, what we're doing to address the regional variations in uptake, which is indeed a point that she's raised with me before. So NHS England works in close liaison with Public Health England to deliver the HPV vaccination programme for girls, and it will be for boys, and closely monitors the uptake rates, and they send me regular reports on that. And local NHS England commissioners have access to those uptake rates within their area, and in due course, so do MPs. And then they work with the providers, with schools, with healthcare professionals to improve coverage, sharing best practice where relevant. So it became very clear to me in looking at that that the variations are there, and that is a concern to me. So I've made it very clear to the NHS my concerns about regional variation in vaccination uptake, and I've met with NHS England, Public Health England on a number of occasions, twice in recent months, asking them for additional action to be taken to increase the uptake across England, and I want them back in my office on a regular basis to report back to me. That does somehow seem to stimulate them. So I'm pleased to see that bringing in local coordinators now to encourage uptake was featured in the NHS long-term plan, which is something that came out of those meetings, along with various other commitments to improve vaccination rates, not just in HPV, but across the vaccination piece, including requiring CCGs, clinical commissioning groups, to ensure that all vaccination programs are designed to support a narrowing of health inequalities. And they know that I remain on their case. And if the honourable friend, the lady from Washington, would like to continue the conversation with me on that, I'd be very pleased to hear that. Now, I spoke about Sir Mike Richards and his review, which the Secretary of State has asked him to do. So cervical cancer affects so many women and their families, and screening obviously can help prevent many from developing cancer. And it obviously is important that women take up their screening appointments to help spot abnormalities. But with uptake at only around 75%, we know that we need to make it easier to book and convenient for women to attend appointments. And it's this access point that's come up a number of times during the debate. I said to Mike when I met with him recently, I have an app on my phone that tells me when my car is due for a service. And it lets me book a local appointment at a time that suits me. We do not embrace this kind of no-brainer technology enough in healthcare. So we've got to embrace modern technology to ensure that our screening programs are fit for the 21st century. It is something that I and the Secretary of State feel very passionate about, and that should offer better ease of access. So doing so, I'm sure, will improve uptake rates. It's one of the key reasons why we're considering comprehensively how our current national screening programs can be improved, particularly in the light of the recent issues that could impact on the public's confidence in screening and the lower uptake. Now, Professor Sir Mike Richards is leading this review for us, as I've said, of all 3 of our cancer screening programs, which of course includes cervical. His review will report in the summer, is when it will report, and it will specifically assess the strengths and weaknesses of the individual programs. It will also address how the latest innovations, as I've just outlined, can be utilised and integrated with research to encourage more people to be screened and make it easier for them to do so. And that was the point that was raised by many, including the lady from Warrington. So I met Sir Mike a couple of weeks ago to discuss how his review clearly needs to set out how we can bring our screening programs right up to date to make them fit for the people who use them, and I await his recommendations with real optimism, actually. Mike is somebody who ran screening programs within the Department of Health before the Health and Social Care Act of 2013. He's somebody with a great deal of experience and somebody with a great deal of credibility within the system, which I think is important. So we have great optimism for his work. Now, on raising awareness, Mr. Austin, we must, of course, do more to raise awareness of not just the importance of taking up screening, but also how to recognise potential symptoms of cervical cancer. This is an area that the Breast Aware campaign, for instance, in breast cancer, has been phenomenally successful in doing. In her petition, Natasha said that she wanted to make a difference to the next generation of young women by raising awareness of the symptoms of this terrible disease. I've seen the videos online of her little girls, heartbreaking, and she certainly raised awareness of the symptoms of this terrible disease. I believe that she's already made a real difference and highlighting the vital importance of women with symptoms contacting their GP as soon as possible. Indeed, it's 10 years now, Mr. Austin, since Jade Goody also took on the fight to raise awareness and sadly died of this illness. And we will be using the 10-year anniversary with the permission of the family of Jade to help raise awareness and to help raise the importance of screening and taking up those appointments. In the aftermath of Jade's sad death, the attendance rates rocketed. And obviously that has waned. And we will be making, in Jade's honour, and Natasha's, the most of that 10-year anniversary to save other women. Sure.
It's very encouraging to hear what he's saying and talk about the legacy of Jade Goody and others. And it is a tremendous thing that they've left us all, the campaigns that we were able to benefit from. But is it not concerning to a point that these examples are younger women? And actually that could lead to reinforcing some of the misinformation about this being something that younger women need to be more concerned about and therefore older women less so. And I just wonder sometimes with the examples that we make so prominent, that actually may cause something of an issue to another group of women.
Yeah. Yes. I mean, it's a good point she makes, and it's always the danger, of course, of public awareness campaigns, and even down to the even down to the models that are used and the actors and the actresses that are used in those advertising campaigns as to how they present and how they position that campaign. I take the point that she raised, and I know that Public Health England, who obviously work on these campaigns for me, would be clear, will take the point that she raises. They will be being sent a copy of this debate, I can assure her. Now, a number of members, including my honourable friend from Henley, who is no longer in his place, have raised the issue of GPs. So guidance for GPs has been developed and published specifically aimed at improving the primary care of young women who present with gynecological symptoms. Now, this guidance, produced by a multidisciplinary group, including professionals, patients and the voluntary sector, and endorsed by the relevant Royal Colleges, offers clinical practice guidelines for the assessment of young women aged 20 to 24 who present with abnormal vaginal bleeding. GPs are continually being made aware of the symptoms of cervical cancer and the need to refer women under the age of 25 for further investigation. Sounds like from today's debate we have further to go. We knew that anyway, of course. Now, as part of the delivery of essential medical services under the GMS, the General Medical Services Contract Regulations, GP practices must offer consultations and, where appropriate, they must also offer physical examinations for the purposes of identifying the need, if any, for treatment of further investigation and, if needed, referring them onwards as soon as possible. So, I thought the Honourable Lady from Rotherham made a really excellent point about understanding the history of some women on their lists, understanding the trauma that some women, obviously it's a subject that the Honourable Lady has a lot of experience of in her constituency, but understanding the history of trauma that some women have. And I think it's an excellent point she's made, and it's a point that I'm going to make sure is fed into Mike Richards' review. So I thank her for raising it. I've mentioned a couple of times Be Clear on Cancer campaign, and I've said that Public Health England will be working to raise awareness of the disease through the Be Clear campaign, which we've run in partnership with Cancer Research UK since 2011, and it's covered lots of different areas, and it will be promoting the uptake of cervical screening is scheduled to run from next month, as I said. And in the 2016 budget, Mr. Austin, the government, while we're still on the point of awareness here, the government announced that Joe's Cervical Cancer Trust, who do so much good work in this area, as has been said, will be a beneficiary of the tampon tax, and they receive £650,000 in funding to kickstart a campaign to get closer to eradicating cervical cancer. I stand in so many of these debates, Mr. Austin, as does my shadow, and talk about cancer. And 1/3 of cancer is preventable, 2/3 of cancer are just bad luck. And some cancers we are nowhere near. But this is a cancer that we can get rid of. This is a bad that we can eradicate. And so that's why we are so determined to get this over the line. So Joe's Trust campaign on eradicating ran over 2017 and 2018. It was a wide-reaching awareness programme with specific focus on groups where there's higher prevalence of non-attendance of cervical screening, which is interesting. So women from Black, Asian, minority ethnic communities, women from disadvantaged backgrounds, the point that's been made, and women aged in the 25 to 29 bracket, and women in the over 50 bracket. And the funding enabled Joe's Trust to provide targeted education information to these groups and to produce a body of evidence on the barriers to screening and how to overcome them. They found that some young people do not attend their appointments because they're embarrassed, and this received a lot of press coverage and then came out in Prime Minister's Question Time last year. Others don't think the test is very important, and yet more don't think that they're at risk because they already lead healthy lifestyles. So 1 in 4 don't attend the screening appointment, and this needs to change. So this is very important work. And I know that from talking to Rob from Joe's Trust, one of the things that they actually really found on the road shows when they were testing this work across 17-18 was talking to partners of women and what an important role they can play in reminding, nagging, whatever word you tend to choose to use, around taking up screening appointments. So last week, Mr. Austin, Joe's Trust held their annual Cervical Cancer Awareness Week event here in Parliament, and their aim is to help as many people as possible know how they can reduce the risk of the disease and then promote that among their constituents. Their Smear for Smear campaign reinforces the message that the smear test prevents 75% of cervical cancer. So while they may not be pleasant, as we've heard, they're very important. And I was pleased to support them myself, as did most of the health team at the event here in Parliament last week. And I thank all members for being part of that. I know Joe's Trust found it very helpful. As Natasha's army say, and this is such an important message, we need to support all young women to lose the fear, take the smear. So, Mr. Austin, if I may try and draw my remarks to a close. The government, as did the previous government and will the next, recognises that cervical cancer is a devastating disease, and we are committed to providing well-managed screening programmes based on the most up-to-date, peer-reviewed evidence. Cancer is right at the heart of the NHS long-term plan, which was published on the 7th of January. And it's something that I'm very proud of, that it is right at the heart of the long-term plan. It sets out a comprehensive package of measures that will transform cancer diagnosis and treatment across the country over the next 10 years, a decade in which patients can expect to see vast improvements in the prevention, the diagnosis and the treatment of cancer. And the aim is to see 55,000 more people surviving cancer for 5 years in England each year from 2028. And it is quite an ambition. But we'll get there. Cervical screening saves an estimated 5,000 lives a year, and the government is committed to continuing to do all we can to prevent cancer and to ensure that early diagnosis, so often said rightly that it is cancer's magic key, so that more families do not have to go through these personal tragedies as the sales have done. We're up for the fight, Mr. Austin. Thank you for everyone taking part.
Thank you. Helen Jones to wind up.
Thank you, Mr. Austin. Can I thank members who have participated in this afternoon's debate? I have learned more about some of my colleagues than I ever thought I would learn. And I cannot compete with their recognition stories. The only thing that happened to me was after I had had a smear test that didn't show abnormal cells but was a bit dodgy for various reasons. I was waiting in hospital for an exploratory op, and everyone was being very, very careful about not saying who I was, until the porter came in to take me to theatre, who proclaimed loudly across the ward, "You the MP then, love?" Yeah, God bless Warringtonians. We've heard a lot of very useful comments in this debate about the need to look at the variations in the take-up of screening, including the variations between regions, about the need to find out what is right, what is going right and what isn't, about the need to be careful how we communicate with women. Again, I had a letter following a mammogram which began, "Do not be alarmed," which is immediately, as I told the person in charge of screening, who happened to be someone I went to primary school with, very alarming. You know, people often don't think about what they are sending out in letters. We've also heard of the need to ensure that the guidance on young women presenting with abnormal symptoms and how they should be screened and treated is put into effect. And I hope the Minister recognises the concern around the tables here today that is not always being followed, because when it isn't, it can have disastrous results. We've also heard the need to review the evidence and keep the evidence continually under review for what should be the best age for screening, and the need to counter any resistance to the vaccination programme for HPV. There is now a lot of false information about vaccination programmes going around on social media, on the internet, and it needs to be countered not by us as politicians, I don't think, but by doctors and clinicians who really understand the value of this. And like the Minister, I too will probably get a lot of angry tweets and emails after this. But we need to make sure that the evidence is what leads us and not false information. So I am glad to hear that the Minister takes this seriously. I'm confident that he does, and I hope that we will be making further progress in the coming years.
The question is that this House has considered e-petition 225767 relating to lowering the age for smear tests for cervical cancer from 25 to 18. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. Order, order. The sitting stands.